Okay. So good morning, good afternoon to everyone. Welcome to Endymed's webinar. My name is Asrar. I'm the Clinical R&D Manager at Endymed. And today we're honored to have Dr. Fabian Perez Rivera presenting all the way from Argentina. Dr. Perez Rivera is an amazing plastic surgeon. He's a good friend of the company. He has over than 25 years of expertise in laser and radiofrequency treatments. Also, he has published more than 27 scientific articles. And today, he will be sharing his success story with Endymed, focusing specifically on his innovative protocol for treating hyperhidrosis. So guys, if you have any questions during the presentation, please feel free to type them in the chat and we will address them during the Q&A session at the end of the webinar. So thank you all for joining, and Dr. Rivera, the stage is yours.
Well, thank you so much for the introduction. I start sharing my presentation. Let me see if you can see it well.
Yes.
Okay. Perfect. Let me doing that. Perfect.
Yeah, we can see it in full screen, yes.
Perfect. Okay, well, this is me. This is the title of my conference. The important thing of all these titles is that I have experience as plastic surgeon since 26 years old, but at the same time experience using different kind of EBD, wave frequency, and laser devices. My conflict of interest, and by this conflict, I have the opportunity to meet many people around the world, have new friends, sharing my experience in different kind of conference, congress, and symposiums. This aging process happened right now over my face and over the face of all of you. It's estimated that the collagen content of the dermis decrease by 100% per year throughout our outdoors life. We need to manage that and make something to have a solutions. And one of the way is stimulate the fibroblast, for example, by wave frequency. By this, you can increase the energy and the heat in the dermis between 52 to 55 centigrades, but at the same time, avoid to increase the energy more than 40 to 42 centigrades in the surface, in the shallow of the skin, to avoid, for example, burns. At the moment you stimulate the skin by heat, you have two different kind of process. The immediate effect, that collagen contraction, and obtain finally a skin tightening and wrinkle reduction, but a long-term effect at the same time, but the collagen remodeling that want to reach at the same result, but in a more duration of time, skin tightening and wrinkle reduction. One of the advantages of the radio frequency is that we can act on different kind of skin type and different kind of color of this skin type, because we don't have the risk of PIH, or the risk of PIH is really few, really low. For example, in this kind of typical skin type of my country, skin type 3, 4, or 5, that we need to avoid the possibility of any kind of PIH by laser. That's one of the goals that we can apply in different kind of skin, but every month of the year. We don't have a problem with the classical suntan in the summer. Over all the radio frequency devices and platforms around the world, I decide to buy this one, and I decide to buy these different kind of handpieces. Fractional handpieces like intensive and FSR, and tratamiento radio frequency handpieces like this you can see here in the slides. And why I decide for a radio frequency platform? Because I have great versatility of indication as treatment of wrinkles, skin tightening, facial folds, stria, scar, keloid, skin laxity, cellulite, local obesity, hyperhidrosis, and osmosis, the hot topic of today, acne sequel scar, radio frequency blepharoplasty, and I use as delivery dry devices. Because I can act in different layer of the skin, On the surface, for example, I choose FSR. This means an ablation on the surface of the skin. For the dermis, I can choose intensive. It means use microneedle inside the skin. And for the hypodermis, I can choose contouring. It means send wave frequency to the deeper part of the skin directly to the fat cells. When I start mentioning tratamiento wave frequency, we need to mention that not all the wave frequency devices are the same. Monopolar wave frequency are really deeper, but without a specific treatment. Bipolar is really specific and can increase a lot of energy in the surface, but not in the deeper part of the skin. Multipolar is like a bipolar, changes positive pole to negative pole, but act at the same bipolar wave frequency. And 3D technology, it means that we have three different kind of positive pole looking at the same time, three different kind of negative pole that create an arc that repel each other, and by this we can reach more deeper inside the skin. As you can see here in this drawing, the way that three different arcs repel each other and go deeper inside the skin, and in these two movies, the way that this heat give the permission to create more collagen cells, and this great balloon of energy go deeper and deeper because these are repelled by itself. And here it's me as the first model of these devices using on the skin of my face, and reach to the energy that we need to start have this stimulate of the fibroblasts. And at the same time use this high fine in the priority area to can obtain, for example, in combining with the surgical procedure in this patient, a friend of mine, that in which one I prefer I perform a blepharoplasty and a cantoplasty to obtain this kind of result, but it's better if I pass the E-fine and can reduce these residual wrinkles in a priority area. When we mention the body treatment, in this way we can reduce this cellulite and stria in the buttock of these patients, and we can reduce forever this amount of fat cells in the lower part, in the in the thighs and on the inner thighs too. When we mention the FSR handpiece, we can obtain an ablation of only 150 microns. That is really safe if you compare with the CO2. And at the same time, we can send energy, we can send heat to all the layer of the skin up to 3 millimeters of deep. And it's important the way that I can send that in 14 column in 8 rows, and the negative and positive pole jump each other to give a possibility to reach all the surface of this tip. And this is the way we can send first the ablations, and after that you obtain this heat send it to the surrounding tissue. This is the typical endpoint. With this dot is going to live on the skin for at least 4 or 7 days. Here again, I'm the model during this treatment. If you can see here, it's impossible as a medical doctor erase completely a scar, but we can get this kind of improved only by this device, only by this. No filler, no laser, only this radio frequency device. This other traumatic scar, I apply first a filler, hyaluronic acid filler, and after that, I apply this device to obtain this great result. When we mention intensive, is mean the handpiece with the microneedle. There are different kind of microneedle. I prefer this one because if you can see here, is the way that have a softly and gentle way to introduce the microneedle inside the skin. And for this way, for sure, we can reach the depth that we choose and we want to send this energy not on the surface, in the middle on the skin. We have this particular handpiece, it's bipolar radiofrequency, 25 microneedles. They are not insulated needles. The sides, they are gold-plated, but the important thing that we have the possibility to reach 5 millimeters of depth, and we can increase the depth between 0.1 millimeter per 1 millimeter if we decide that. We can choose at the same time the energy and the post duration. That's why we can make our own recipe of treatment. The classical difference between the insulated microneedle at only the tip, the non-insulated at in all the length of the needle, but when you use the fractional way to send the energy, you can act like a cars on the high-speed train. That means we can summer all the different kind of wagons inside the train to obtain a great volume of energy around the needle, and by this we can reach more quantity of tissue damage or being acted by this energy, and by this we be sure, for example, when we treat sweat gland, we can reach more quantity of sweat gland, and by this we can reduce more quantity of sweat. And all of this is a matter of impedance. It means the resistance of our skin to the pass of any kind of energy through it, and is really higher in the dermis in compare with the low resistance on the hypodermis and the epidermis. That's why all the energy is going to be attacked, and we catch by the dermis, and this is the layer in which we want to act. I have part of the INCAS board member, and by this I was invited for many conferences of INCAS in Americas, Asia, and Paris. And during 2022 in Paris, I was walking about the corridor looking for interesting conference. And with that microneedle radiofrequency sessions, I go inside, and for my surprise, Sergei Dahan, at this moment the president of the Dermatology Society, showed as the best result one of my cases, and the second case that he showed was one of my other cases, as this the way I can act over the sequel acne in the face of this young male. And we can reduce this scar, not make disappear all of them, but we can reduce by this microneedle device. When we mention skin laxity on the cervical area, this is the way I act on the jawline. I pinch the skin to be sure the needle reach to the depth that I choose. And by this, we can obtain this kind of result. You can see here the way have a bad angle between the neck and the chin and the neck, and we can increase the angle using this device by the contraction of the skin, by the tightening the skin in the neck. And this heavy neck, we get a lot of fat cells and laxity. First, I apply the laser, endolaser and liposuction. I obtain this result. I don't really agree with this result. I think we can get more improved in the area. That's why I apply the microneedle and obtain the contraction on the skin on the chin. And over this other patient, I act in the same way. First laser and liposuction. This was my result. I don't agree with the result. I decide to apply the microneedle to get improved in the jawline and in the angle on the neck. In some cases, I combine FSR, it means the ablation on the surface of the skin, and the microneedle to go inside the skin. Like in this case, the patient that I performed blepharoplasty, but I took enough time of skin. This is the residual skin after the procedure, and the way I obtained the contraction and a better result after I apply this combination of handpieces. Or this other patient, 65 years old, we have a lot of wrinkles, we have a lot of skin laxity, and at the same time, some epidermal lesion, lentigos. Well, with ablation, 150 microns of ablation, we can be successful to erase these lentigos and at the same time reduce the amount and the depth of these wrinkles and get improving all the quality of the skin over these patients. Skin laxity on the abdominal area. This is the patient that I showed during INCAS 2022. And you can see here it's a good result of the liposuction, but in a close view, you can see around the navel is skin laxity and excessive skin around the navel. And the way I can obtain the contraction only by microneedle and obtain this good result. Other patient with the same problem, a lot of skin laxity around the navel, and I performed a subcision and lipofilling on this scar, and only microneedle around the navel to obtain in a close view this great result. Another patient, again, a lot of stria marks that is, of course, if I perform a plastic surgery, I obtain better result, but the patient want to avoid a surgery procedure, and I can obtain this contraction of the skin by the microneedle. Well, finally, the goals of microneedle, by the heat, we can obtain skin contraction, skin tightening, skin lift, skin remodeling, fibroblast cell stimulation, improving the quality of the skin by all these steps. But if you can compare with Argentinian asado, with the classical barbecue, we can reduce the size of, in this case, the stick by the heat, but in your hands, you can obtain the contraction of the skin to get improved the quality in the skin on the body, on the face of your patients. Finally, the hot topic of today, the way I act or hyperhidrosis or osmidrosis. If you look right now for this phrase in your cell phone or your computer, the less hygienic celebrities, you can obtain this embarrassing moment of people for famous singers, people from royalty, for famous sport celebrities, that they have this embarrassing moment because they have this sweat on the armpit. And usually people associate sweat and armpit odor with poor hygienic or lack of personal care, but nothing is far from reality because they are really concerned about that. They're really concerned about people in the lower area and in the social area think about them and they look for a solution. Additional for these people who suffer with this illness, hyperhidrosis, osmidrosis, all of us have relations in lower area or social media are really concerned about people think about us and think about our hygienic situation. That's why we need to avoid the sweat on the armpit, even more the odor. Hyperhidrosis, if it means the excessive sweating that occurs spontaneously without being caused by high temperature or by situation or physical emotional stress, and whose chronicity interferes with normal work and social activity. In summary, excesses without any reasons. People like you, like me, in this moment, start to sweating by drops without any cause. This is the situation of hyperhidrosis. We have two different kinds of sweat glands, the eccrina and the apocrina glands. The eccrina glands are the responsible of the 90% of the sweat, and the apocrina glands are the one responsible for the odor. Hyperhidrosis usually is symmetrical and begins in adolescence. It's being suffered by a lot of people around the world. 3 to 5% of world population suffer about that, and it's estimated that 2.5 million Argentinians suffer about that, and majority of them didn't know that have a solution for this. It appears more frequently in Asians, especially in Japanese. 40 to 50% are cases are hereditary. That means we have grandfather, father, son, and grandson suffer or will suffer about that. And the more common area are the armpits, and by this for the axillary hyperhidrosis. The osmidrosis is caused by the ceramide generated by the subprocrine gland that when they can reach to the surface of the skin, they suffer oxidation action by when they combine with the saprophytal bacteria on the skin. Usually are only staphylococcus, but in some cases are worse, are corynebacterium and anaerobic, and create a worse odor. And in some cases, can be acquired cause, but majority are genetic cause. Acquired cause, we need to look for diabetes, thyroid pathology, adrenal pathology, in some cases, incomes of pharmacology, food, or alcoholic, but majority of the cases, as I mentioned, are genetic cause. Our patient create a special pattern of behavior to avoid any people notice about this great odor or about the sweating on the armpit. That's why they avoid the hugs, avoid the contact, avoid to move a lot the arm to show the armpit, and they shower several times the day, and they change the clothes several times a day, as I mentioned, to avoid any people notice about this situation. If you look for a scale in the way we can measure this hyperhidrosis, you're going to find this hyperhidrosis disease severity scale is a non-objective scale. The patient need to tell us in the way that this disease interferes the social or laboral activities. We can put in a scale between 1 to 4. And osmidrosis classification, again, is a not objective scale in which one the physician need to pass a gauze over the armpit, smell it, and put in a scale between 1 to 5. Starting with the treatment, we have surgical and non-surgical solutions. In the surgical solution, we can tell about endoscopic thoracic sympathectomy at level 3 or 4, cutaneous excision, subdermal curettage, liposuction, subdermal ultrasound, and subdermal laser. And in non-surgical solution, we need to mention the topical solution of aluminum 20%, iontophoresis, oral medication, botulinum toxin, transdermal radiofrequency, and intradermal radiofrequency. I want to talk about this final topic, intradermal radiofrequency. It's important to put focus in this drawing because not all the sweat glands are in the same deep of the skin, while the echinal glands are more superficial, are between 2.5 to 3.5 millimeters of depth, and go directly to the skin by the duct. The apocrine glands are deeper, are between 3.0 4.0 millimeters of depth. That's why they need to reach first to the shaft of the follicle of the hair, and then reach to the skin. That's why are more deeper, and we need at least a needle to reach 5 millimeters to reach both kind of echinal glands to be successful. That's why I choose this tip, because can reach to 5 millimeters. And as I mentioned, I can choose the depth, I can choose the time, I can choose the intensity to obtain finally the thermocoagulation inside the skin or inside the dermis. And as you can see here, we can create this coagulation zone, and by this, all the echinal glands in the surrounding of this tip is going to be lesion, is going to be destroyed, and we can reduce amount, at least part of the average of sweat forever. There's two kinds of tests to measure the way we can reduce this sweat. The first one is minor test, in which one we apply povidone solution and then talcum powder over it, and we obtain this drawing. and we can measure the way this drawing reduced after the session. And in some cases, these tests help you to notice in which area on the armpit you have more quantity of sweat glands to be more effective of send more power over this area. For example, in this right armpit, we have this drawing, and on the left side, we have this kind of drawing. That's why I can put focus only in this part on the upper armpit, not in the wrist. And there's another objective transdermal water loss measurement. This device, I don't have it, but you can obtain for sure more precisely evaluation of your results. This was the first scientific publication that I read in the past about the use of microneedle for reduced hyperhidrosis, and giving the possibility to start a study and make my own experience. And by this, since July 2014, I started applying over the patient with hyperhidrosis. Nowadays, a total of 208 patients was treated by me. We do two different kind of devices. The first one was with insulated microneedle, and the second one with not insulated microneedle. This is the rate of the age and the average of 21 years old. This experience gave me the possibility to win an award of my society, of Plastic Surgery Society of Buenos Aires, and give me the possibility to publish a paper in 2019 in which one I found a 50% of reduction of sweating in 80% of the patients. But during this day, I still 4% of complications as burns, scar, hyper and hypopigmentations. That's why give me the possibility to still looking for a better device. And during INCAS 2022, I showed this experience applying these devices on the armpit of these patients that suffer of hyperhidrosis and osmidrosis at the same time. And give me the possibility to travel around the world showing my protocol over hyperhidrosis and osmidrosis. Nowadays, was performed that in Paris, Madrid, Bogotá, Medellín, Buenos Aires, Santiago de Chile, Jakarta, Istanbul, Warsaw, Quito, Guayaquil, Montevideo, Bangkok, and for sure, I want to show that in many other parts of the world too. Nowadays, step by step, here is the way I act. First, I perform the minor tests. By this, I obtain the drawing. After the drawing, I can evaluate the complete dip of the thick of the skin, and measure that. I can choose the parameter of the microneedle. After that, I apply local anesthesia, lidocaine 2%, put the parameters, the dip, the duration, and the intensity, and apply over the patients. And when we choose appropriate glands treatment, again, I can measure the thick of the skin. Is little lower. Bromidrosis, male 3.0 to 4.5, female 3.0 to 4.0, and we have hyperhidrosis and osmidrosis at the same time. In male 2.0 to 4.5. I select different kind of dip in the two passes. The first one are more deeper, the second one are more shallow, and in female 2.0 to 4.0. In the post-treatment indication, usually indicate only moisturize, indicates baseline, avoid sun exposure, avoid extreme exercise to avoid any kind of lesion on the skin by make any kind of erase or kind of obtain any kind of lesion on the surface of the skin by this external exercise. And if it's another problem, I apply give the indication to apply at the same time any kind of antiseptic, for example, chlorhexidine, to reduce the amount of Corynebacterium and anaerobic bacteria flora. Complication and side effects. At the moment, I decide to change my radio frequency platform. I have only one permanent injury when compared with the 4% that I have in the past. The classical contraindications of any kind of radio frequency device: pacemaker, pregnancy, local infection, history of keloids. There are many research. Sorry, I made the research. I would say many publications talking about the treatment of microneedle over the hyperhidrosis. And this one especially, they evaluate and give a strong recommendation or use this kind of devices for hyperhidrosis. On this other one, they control the patient for a complete year, and they obtain a permanent change in 41% of them. In conclusion, for me, the use of this kind of radio frequency platform for hyperhidrosis is another treatment of this one, as effective and novel non-surgical treatment for axillary hyperhidrosis and non-hydrosis. There's always destruction of sweat glands. That's why you always have a decrease, permanent decrease of some degree of sweat and odor. Without complete lesion of the epidermis and papillodermis, you can obtain a total restitution of the skin. That's why you can avoid scars. And this treatment is not only for hyperhidrosis or non-hydrosis, put the focus on everyone with high social or labor requirements. Finally, if you believe in the device, you believe in the treatment, and you believe in yourself as medical doctor, you can treat your own daughter. Just in this case, I train my daughter Lola. I invite all of you for any kind of INCAS conference around the world. The first one is going to be in Paris in between January and February of 2025. And I am part of the board to INCAS in INCAS. I invite you in April in the city of Sao Paulo in Brazil. And I invite all of you to the ICE1 Congress in Jakarta on December, because I'm part of the board too. I hope you enjoy my presentation, and I'm ready for the Q&A session.